being in the Global Leadership Exchange here has helped me realize that I'm really interested in biology especially. So over the course of the past 3 years, I've taken a lot of biology courses in biotech. I originally was looking for an internship where I would be able to apply some of the techniques that I've learned in my biotech classes, so I definitely wanted to be in a lab. But I was also interested in starting to look at the clinical aspects of medicine, because I know something about medical research, but not so much about dealing with patients. So I had an opportunity to work at a research lab at Columbia University Medical Center over the summer, and I've decided to continue it throughout the school year. This lab is part of the division of cardiothoracic surgery. So the main focus of the lab at this point is to develop a scaffold to implant in post-heart attack patients. When a patient has a heart attack, there's a lot of local tissue death, and so the hope is that these scaffolds can be implanted in a patient and that they'll contain heart cells, so that these heart cells in the scaffold will actually help to regenerate the heart. So every Wednesday that I come in, my primary responsibility is checking the stem cells that are in the incubator and just making sure that they look okay, and changing out their media. Their media has to be replaced twice a week just so that they have the nutrients that they need to keep growing. After that, I'll usually meet with my mentor in the morning and talk about what needs to be done for the day. If there's not a lot to do, I can go and watch surgery, but lately we've been really busy. My role in the lab has been mostly with cell culture. We're working with a form of adult stem cell and attempting to get these stem cells to differentiate into heart cells. So I've been working with these cells in various combinations of growth factors at different concentrations to try to get them to differentiate. We look to see if the cells are starting to express genes that are more specific to heart cells, which will, tell us that we're on the right track or we need to switch what we're doing. So I think this internship is great because I've had the opportunity to develop my lab skills, but also to see what a hospital environment is like and what it's like to be a physician working with patients. So I'm hoping that when I go to college, I'll be able to major in biology and enter a pre-med program. At this point, the idea of being an MD PhD is something that I'm really interested in. So we'll see if that, happens in the next few years.